Hi guys, welcome back to my channel. So today's video, I'm just looking at my phone. I want to talk, before I start the video, next door they're doing some sort of works and it's very noisy, so if you hear noises it's because of that. Also, our smoke alarm battery is low, which is why it keeps beeping. I'm so sorry, but I just have to film this video now, otherwise I'm never going to do it. So today's video is going to be, I'm going to just be talking about my third year experience. I've just finished, well not just, because summer's actually over and I'm starting uni again in like 2 weeks. But I finished third year and I just want to talk about my experience, how I feel about or felt about third year, and some tips. This video is going to be very much ADHD brain. I'm just going to be talking. It's not going to be very structured because I didn't sit down to plan it, which is probably not a good idea. I'm just going to put these earrings on just because they're just sat in front of me and they're very pretty. But yeah, let's just get into it. So to sum up third year in one word, the ghetto. That's 2 words. Third year in one word, pain. That's my one word. Yeah, it was just long. So to start off with, obviously COVID and all of that, we still had placement, which meant that, you know, we were still going in, we were still going to hospitals, GP and all of that, but our learning experience was obviously different to how it's meant to be. Because, so for example, I started off third year with special senses. Special senses is comprised of dermatology, ophthalmology and ENT. I had those in Bradford, and obviously with COVID, a lot of staff were deployed to the COVID wards, meaning that sometimes we didn't have teaching, sometimes we would go there and it's kind of like, why are you here? And the patients that because we still saw patients, the patients that we did see were basically like emergency patients. I think after a while, it gets very boring because you're seeing the same things over and over again. The good thing about special senses though is that, so for those 3 specialties, you're only there for a week each time, which is literally the perfect amount of time, because by the time I'm about to get bored, I'm going to the next one. So dermatology it was alright. Obviously, if you've been following my channel, you know me, you know that I did want to do dermatology for a while. I don't want to do it anymore, not because of anything like deep. I'm just bored of it. Like, I'm a skincare girl, well, I was a skincare girly, right? But now I've become obsessed with them, which is the reason why I started my YouTube channel, is because I wanted it to be a skincare channel. But I'm bored of skincare now. I don't really care, and the medical side of dermatology is not appealing to me. It's very boring to me, so I don't want to do dermatology anymore. That was sidetrack. Anyway, yeah, dermatology was okay. I'm trying to think because I can barely remember it. All I remember is that it was not very well organized, but you know what, I don't even blame them, because honestly we were like the first group. So special senses, like I said, it was in the first term and we were the first group to have special senses while COVID was going on, so they were trying to figure it out. Hopefully the groups that came after us, you know, had a good experience, but we didn't really, I'm not gonna lie. ENT, I had COVID for. Yeah, that was the second time I had COVID. So I wasn't in for that. I was in for 1 day and then I started getting symptoms. So I self-isolated and then I tested positive. So I can't really speak to that. But the 1 day I was there, it was only good because the consultant, or no, he was a registrar that I was with, was good. Like, he was one of those registrars that they want you to learn, but it was a lot. But obviously I was only there for a day, so it was fine. Ophthalmology was boring as hell, oh my gosh. But the doctor I was with, he was also a registrar, was so nice. Like, he was getting me involved, he was letting me use the slit lamp, but like not just like, oh, just to see, like he was proper making me do it. Like, he was proper getting me involved, and I really appreciated that. He explained everything in detail. So yeah, it was a good experience, but I just didn't enjoy ophthalmology. I found eyes really boring. So that was dermatology. That was special senses. I didn't realize this was the way the video was going to go, but it just makes sense for me to go through each rotation. Okay, so the next rotation was, I think it was general medicine. So I was in Leeds for general medicine. I was on the respiratory ward, of course I was. So I don't know, but I've always really enjoyed respiratory, and I don't know what it is. When I did work experience back in year 12, that was obviously my first actual medical, like, it was really work experience. That was the first time I was actually, like, you know, immersed in medicine. And I was on the respiratory ward with a respiratory consultant, and he was sick. And I think that's the reason why I've just always loved respiratory. Maybe that's what I'll do. I have thought about it a little bit, but not really, because I don't really want to think about what I want to do, because that means I have to actually accept it and then have to try and like make effort in it, and I don't want to do that, so I'm just going to keep ignoring it. But yeah, so respiratory was calm. The consultant, our placement lead, he was nice. He did regular teachings over Teams every week, which was good. So what happened was, because obviously COVID, and we're put into groups, it depends where you are, but on respiratory it was, I think it was 5 of us. So what happened was, we basically had shifts, so we wouldn't all be on the ward at the same time, because there's not enough space. There's not enough staff who actually have the time or interest to teach us. So we would be on there like 2 at a time, I think. Yeah, so literally we weren't there every single day, which was great. Actually, no, that's a lie. We were somewhere every single day. It was I think we were split between 3 wards, and we would be moved around. You look at the timetable, look at where you are, and know that's the ward you're on. I can't lie, I was not there. I could get bagged for this. No, I can't actually, because no, I passed the rotation. But not that I was not there, but I would look at it, look at what I need to get signed off. So we have these things called DOPS. What does it stand for? I don't know, but it's like practical stuff you have to get done throughout the year. And we have stuff called mini kexes, which are like cases you need to get signed off. So obviously I would look at what I need to get signed off. One of them was, I think, acutely unwell patient. So obviously I'd say, okay, today I'm on this ward. This ward is really good for seeing this type of patient, or I know that this doctor is going to be on this ward, so let me go in and get it done. If I was feeling depressed, I'm not going in. If I was feeling tired, I'm not going in. If I was feeling like I had work to catch up on, I'm not going in. If I'm feeling like I'm going to go there and everyone's just going to be stuck, like, listen, as much as people say like, oh, you know, you have to make the most of it, there's always something to do, blah, 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 it's a lie. Sometimes you will go there and there is nothing to do. Listen, I'm not going to go and do the most. I'm not being paid. I'm a student. I've got work to do. I'm tired. The laundry needs to be done. I need to do a food shop. I've got content to film. I want to do my makeup. I want to look cute. I want to go shopping. There's always something that I value more, or I feel like I want to do more than just stand on the ward while people are walking up and down ignoring me. I don't know what point I was making, but I think my point is, this is the tip. Just be smart about placement. Don't go and kill yourself for placement. Don't go and kill yourself for placement, because guess what? You're still going to pass the rotation. You're still going to, unless you have a proper strict placement lead and they are on the ward, it's not that deep. It's really not that deep. I feel like I've gone off topic, but that's fine. I don't know what else to say about that. I think my next one was GP. I loved it so much, and not necessarily because I was doing stuff, but because, so the practice I was at, I was the only med student there. They were so nice, apart from this one receptionist. I don't know what her problem was, and she was just rude, but I don't care. But everyone was so nice. Like, all the doctors were nice, all the other receptionists, the healthcare HCA, healthcare assistants, nurses, everyone was really, really, really nice. I got everything signed off. I got so much. Listen, this is another tip. Get your stuff signed off in GP. GP is where you're going to sign everything off, especially, so a lot of the time, your placement lead, and this goes across all rotations, everything, your placement lead won't necessarily know what you need to get signed off. And on top of that, your placement lead is often not the person who is on the ward supervising you. It's often just a random doctor. You go there, they know you're a student, they know you have to get stuff signed off, and they ask, okay, so what do you want to see today? What do you want to do today? You be smart. You know you want to get a catheter done, and you want to, what's that thing? Examine. You want to do an examination on a patient. Tell them these are the 2 things I want to get done, because one, they will make sure, if they're nice, then most of the time, 9 out of 10 times they are nice, they will make sure that you get those stuff done before you go home. 1. 2, once you have that done, you can use that. I don't care, I won't use an excuse. I'll just say I have to go now and I'll leave. But if you're shy or you feel like, you know, you don't want to get in trouble or you want an excuse, you can use that as your excuse to say, you know, I've got what I need to get done now, so I'm just going to go home and study, if that's okay with you. Done. Perfect. So, you know, 2 birds in 1 stone. You're going home at 2 p.m. and you've got 2 things signed off. Perfect. But yeah, GP was sick. So obviously we didn't really see, well, I didn't really, because I was the only one there, didn't really see patients face to face. I'm starving. Didn't really see patients face to face, which was fine because we saw a few. They were the ones that, you know, the GP would do like a triage, telephone consultation, and decide which patients can be dealt with over the phone, which should have a video call follow-up, and which should be brought into the practice. I did loads of telephone consultations myself, which was really great actually. Like, you get used to, what was that? You get used to talking to patients, you get used to learning the lingo, and you actually have to think for yourself, because when I was doing them, the GP was not in the room and I had to tell them, this is what you're going to be prescribed, this is what I think it is, and the GP is going to call you back. So I had to tell them that myself, so you had to know. And obviously GP is so general that I was getting stuff. So for example, ENT, I was not there for that week and I did not revise it, but I was getting telephone consultations with patients who had ENT problems, and I had to use my brain. Like, I had to really reach into the depths of my brain to try and figure out what I should do. Obviously, if you don't know what to do, when I didn't know what to do, I would literally say, I'm going to speak to the doctor, they will call you back, which is fine. But yeah, GP was great, I loved it. Then my next one was, what was my next one? Elderly medicine. Do you know what? Elderly medicine was good. I just don't like traveling far, and I don't like placement leads who are doing too much. Like, I get, you know, your experience, you've had students before, or you're really enthusiastic about your specialty and blah blah blah, but can you just relax? Like, just calm down. It's not that deep. It's not that deep. The teaching so my GP was in Leeds, my elderly medicine rotation was in Wakefield, so I was split between Pinderfields and Dewsbury District Hospital. The teaching, which was done at Dewsbury, was top notch. Like, that's the best teaching I've had. It was clinical teaching, so OSCE prep, that kind of thing. What was his name again? I can't remember his name, but he was like, he was such a sick clinical educator. Yeah, no one else. Actually, to be fair, the teaching at Leeds is quite good as well, but he was just really, really good for OSCE practice and for like clinical skills. The wards, again, we had a timetable. You'd be on a certain ward at a certain time. The wards were also calm as well. Like, the consultants were very much get you involved. The cases were like, you really feel like this is medicine, do you know what I mean? Like, you really feel, I felt that way on general medicine and with GP, to be fair, but this was like, because it's like, you've got elderly patients, they have way more comorbidities, you have to think about how these different things interact and all of that, and yeah, it was eye-opening. But can't lie, my placement lead, she was doing too much, and she was doing a lot of, and you know what, it wasn't just her, but it was other like doctors and other educators were acting like she's so big and bad and she's so scary. Is she going to beat me up? No, you're not going to beat me up, and you're not going to fail me either. So what is this? I don't understand this, you know, this culture of trying to intimidate students, like, oh, I'm so strict. Okay, anyway, and that's the only thing bad I had to say about that placement, really, and the fact that it was far. But so I don't drive, but you'll always have people who are in your group or going near, or, you know, or your friends who are around the same place as you or going to the same hospital as you can probably get a lift with. If not, I can't lie, hold tight in it. Like, if your placement is far, or it's like in one one remote area, you have to wake up early. You will have to wake up early, and that is annoying, but it's fine. Oh, there was a mock OSCE at Pinderfields, which was good. But actually, no, it was not really good. It was not placed at the right time in the year for me to really get... I'm one of those people that, like, you know, when teachers are like, oh, we'll give you a test at the beginning of the term so that we can see where you're at, that does not work for me at all. For the only, like, it's useless. I need to, if I'm going to be tested, it has to be after I've revised. And obviously, even though it was quite close to it was within exam season, I had not revised OSCEs or anything like that, so I was not ready for that. But that's fine. And then my last rotation was surgery. Surgery was so blessed. It was in Leeds, and obviously COVID, so surgery was not, like, you're not really on wards like that, you're not really seeing patients. If you're in Leeds for placement, your attendance is going to be 10%, I can't lie. Apart from, obviously, if you have a really, really strict placement leave. But, like, what I've noticed is, if you're in Leeds, it's so, like, everyone's so busy, and there's so much going on, and you're never in the same place. Like, I'm not going to be in the same place all week. If I was, then they would know, you know, if they've got these 2 students who are there every single day and I'm never there, they would know that obviously I'm not going. But if I'm like on this ward one day, this ward another day, and this ward another day, and each time I'm on the ward as well, there's different doctors. As long as you're there long enough for the doctor to say, oh yeah, I saw you last week, you're calm. It's when they start noticing that all the other students are here all the time and you're never there, that's when it's a problem. So just don't get caught lacking in it, just be smart about it. But yeah, surgery was good. I was on colorectal surgery. My placement lead, he was a joker. He was so nice, so understanding. He had really good teaching sessions. I can't lie, I forgot what I was going to say. It was interesting. Went into theatre a couple times. Yeah, like, surgery is not something I really want to do. Like, it was interesting. And it was obviously like, oh my gosh, like, this is a person who's actually, I'm looking at somebody's insides. Like, that's so, like, crazy. But after you've seen it once, it's kind of like, okay, what am I meant to do? Like, you will just stand there. If you don't, and that's another thing. And this is in general, not just with surgery. If you're not assertive and say, I need to go now, I've got a bus to catch, I've done what I need to do today, I want to go study if that's okay. If you don't say these things, you will be stood there until 6 o'clock. You will be. And the thing is, a lot of these doctors are proper, like, passionate about their specialty, so they think you want they think you want to be there. Sometimes they know, and obviously when they're younger they kind of get it, but sometimes, like, they really think you're as interested and as enthusiastic as they are. So if you don't say, I need to go now, it's peak. Obviously don't take the piss and be asking to leave at 11 AM because you'll get bagged. But yeah, so that was all of the rotations. In terms of exams, yeah, so they say that 4th year is the hardest year, which is why, anyway, I'll do another video talking about how I feel about going into 4th year. But 3rd year was quite peak, I can't lie. 3rd year was very peak, and the way the exams went for a lot of people was not fun. So just have your wits about you. When people are saying, oh no, I haven't started revising, they're lying. They have been revising. You make sure that you're not the one left behind. Start revising from early. Practice OSCE stuff early. Practice OSCE stuff early. I can't stress that enough. I did not practice OSCE stuff early enough and I had to cram it. The written, I need to make a whole video. All of you, forget about Anki. If you're in 3rd year, forget about Anki. In fact, 1st year, 2nd year, I don't know how helpful this would be in 1st year or 2nd year, but if you're in 3rd year, forget about Anki and go and purchase PassMed and QuesMed. That is what you need to do for written exams. Forget about Anki, forget about Quizlet, forget about, to some extent, writing out notes. PassMed and QuesMed is how you will pass. I'm telling you now, forget about all of this, oh, spaced repetition, blah, blah, blah. Yeah, I mean, it's calm, kind of, if you are doing that from the beginning of the year as and when you're learning stuff. But, darling, forget about all of that. Go and get one of your seniors, one of the older years notes. Do what you want to do in terms of absorbing those notes. So if you're using Anki to absorb the notes only, not memorize, just absorb the notes, fine. If you have to write them out, fine. That's what I did because it was good to have, because obviously with exams you could use your resources, so it was good to have my physical if the question's about anemia, I can go to my anemia page and look at everything. So that's why I wrote it out, and writing it out helps me remember. If for you that's mind maps, that's also great. Have your method of how you absorb the information, but in terms of consolidation, PassMed and QuesMed is all you need. You remember back when you're doing GCSEs and A-levels, physics and maths tutor, that's all we did. So why would you change that method when you go to uni? It's the same thing. Just make sure that you're revising those questions over and over and over again, because you'll eventually notice patterns. As soon as you see 21-year-old man was playing football and developed chest pain, you know what, you know it's a pneumothorax. Like, you just start to see patterns, and it saves you a lot of time, and you learn how to categorize things quicker and earlier. That's all. That's what I have to stress. Another thing I did was with PassMed and QuesMed, when I noticed things like, for example, oh, if it's on the left hand side it's ulcerative colitis, and if it's on the right hand side it's Crohn's disease, that kind of thing, I'd write them down. So I had my notes, so I'd have my notes on inflammatory bowel disease. You see how 4th year is going to be bad for me, and God forbid, inflammatory bowel disease. So I'd have my notes on everything, how I've written it down, how I've absorbed that information. But then when I'm doing the questions and I keep noticing these patterns come up, I would then go and write down on the back in purple pen. I don't know why I use purple pen, but that's just what I used. Write down Crohn's is right hand side, ulcerative colitis is left hand side, that kind of thing. And it really helps. And especially when it comes to exams, if your exams are online and open book, be smart about how you have your notes and how accessible they are to you, because going on the computer and trying to find and open documents is difficult. I have a laser appointment in less than 15 minutes and I need to take my makeup off, and I'm just here talking. Do I have anything else to add? I don't think so. I think I've said everything. You can't, okay, these are just to summarize. You can't come and kill yourself. If you need to go home, you need to go home. Placement is going to be there tomorrow. It's not that deep. 2, if you need help, ask for it. Contact your uni. Somebody will be there to support you. If anything, at least let someone know so that there's a record of it, and if you need to prove it later on, you have that. Exams, start revising exams early. I know it's difficult, but at least as you go along, be consolidating the information a little bit, so when it comes to exam season you have a background knowledge there. PassMed and QuesMed is all you need. Forget about Anki. I can't stress this enough. Forget about Anki. Don't know who I'm shouting at, sorry. I can't remember what my other tips were, but that's all I can remember fresh in my head. If I have anything new, I will add it to the end of the video. But thank you very much for watching. Comment down below any questions you have, or you can DM me on Instagram. My Instagram and TikTok and everything is down in the description box. And you can also comment down below any video ideas. Thank you very much for watching. I'll see you in the next one. Bye!